at this point in your new patient procedure, we've taken your history, we did your exam. The next thing in the process is to give you a report of findings. And that's where I'll come in and I'm going to explain to you what we're finding, and I'm going to lay out a treatment plan to show you the path that we're going to take to get you better. Here at Thatcher Chiropractic and Laser, we use two forms of therapy to treat our patients. The first is the use of the Activator instrument to provide the chiropractic adjustment. The second is a newer technology, which is a healing laser. I've been practicing for 36 years, and the chiropractic by itself is amazing. But when you combine the chiropractic and the laser together, it is phenomenal. Here at Thatcher Chiropractic and Laser, the instrument that we use to deliver the adjustment is the Activator 5. This is the finest technology in delivering a spinal adjustment that there is. The Activator has actually been around over 50 years. I've been practicing 36 years at this time, and it's the only instrument that I've ever used in my career. The reason that we use the instrument is that it's very safe for the patient. It's very gentle, but it's also very precise in hitting just the right spot at just the right angle. We can also adjust the tension on the instrument, so depending on the size of the patient or the part of the body that we're treating, we can choose the amount of force that's appropriate for that. So this Activator instrument allows me to give you the adjustment that you need to provide the relief that you want. Each time you come into the practice, the staff will assign you to one of the treatment tables. When you find the correct table, you're going to empty your pockets in this plastic box so you can put your keys, your phone, whatever in here. Then you're going to pull a piece of face paper and lay yourself down on the table. Make sure that you allow your feet and your ankles to hang over the end of the table, which allow me to do the testing that I need to do. And then just relax. It's important that the patient relax for a moment before they have their adjustment. This allows your body to receive the adjustment better if you're more relaxed. And I'll come up to the table and I'm going to be doing some testing. You'll feel me looking at the length of your legs, comparing the right to the left. And I'll have you do some different movements with your body, putting your hand on your back, turning your face, various movements, allowing me to test various parts of your spine, which will show me precisely where to treat. In addition to your chiropractic adjustment, I may also recommend that you use our healing laser. This would be based on your history and on your level of pain. A lot of people are not familiar with the laser therapy, but it's actually widely used now in many medical applications. An example would be a few years ago, my dad had throat cancer, and they went in with a laser and they actually cut the cancer out. My dentist uses laser to treat gum disease. The way that we use laser here at Thatcher Chiropractic and Laser is to fight inflammation. And so much of the pain that our patients have is inflammatory pain. So if we can reduce that quicker, you're going to feel better quicker. The laser also helps to accelerate healing in the body, again, getting you out of pain faster. And for so many of our patients, laser therapy can do just that. So in your report of findings, I'm going to show you this graph, and it illustrates 3 phases of care. The first phase is the relief time, the second phase is the healing, and the third is the wellness. The relief time is when you have to come typically 2 or 3 times a week, and that often will last 2 or 3 weeks to get you out of pain. Then you're going to graduate and move into the healing phase, and this is probably the most important time, because this is when the ligaments and the muscles are actually stabilizing. You're not coming so frequently, but the body is actually healing. And then finally, you graduate into the wellness time. And that's optional, obviously, but a periodic visit makes sense to stay healthy and not go back into the same place where you were. I will always give you my best recommendation, and then I need you to communicate back with me on what you can do, either from a scheduling standpoint or from a financial standpoint. We don't want to add more stress to you. So let's have a conversation and work out a plan that works for you.